Let's talk about one of the big initiatives you announced just recently, and you and I have discussed this, but there's still more to talk about, okay, with the mental health plan. And so it includes hospitalizing New Yorkers, for those who don't know, with severe mental illness. Who makes the call, and I know we've talked about this, but I want to go over it again, that someone needs to be hospitalized, and what's the criteria to make that call?
Well, first, there's a level of clarity that's needed for everyday New Yorkers, as well as the clarity we wanted to give our first-line responders to this issue. The call we put in place is to give them the clarity that if a person cannot take care of their basic needs to the extent that they are in danger to themselves or others. So not every New Yorker that's dealing with a mental health illness is going to be brought inside a hospital for evaluation. We need to get that clear because people keep saying that, and that is just untrue.
Right.
The first line responders, this whole issue is being led by mental health professionals, not police officers. Police officers are part of the partnership. First line responders, based on the training that we're giving them, would do an evaluation to determine if a person needs to go to a medical facility, so a professional, a psychiatrist, psychologist, whomever is there on that capacity will make the determination if they have to go for long-term stay or if they have to deal with the crises that they're facing now.
Now, you said this to me before, that we're not leading with police, right? That they're not leading the charge. You just reiterated it. So who is then tasked with the transport of taking someone to the hospital?
EMS, FDNY, if it's an emergency situation that a person is doing something extremely dangerous, the police can play a role. It's about the combination, and that's the uniqueness of this situation. That's why we invested in Be Heard, to use first responders other than police to address this issue, and we're proud of that. But we can't, anyone who's stating, Dan, to allow the status quo to stay in place, it's unacceptable. We cannot allow people in an inhumane way live on our streets, ignore them, and act like it doesn't exist. I'm not going to do that as the mayor.
So lawyers for City Hall said that no one's actually been taken in just yet. When do you anticipate that happening?
We're going to get it right. It's about proper training, proper evaluation, and put in the proper infrastructure. Now, remember, we have been doing this already, but after the evolution of the program of removing encampments, of engaging with people in the streets, we noticed while being out on the ground that many of our first responders had a lack of clarity on what they can do. When I'm in the subway system and I see someone clearly cannot take care of their basic needs, talking and yelling to themselves, waiting for the spaceship to come and take them back to Mars, that's a problem. And once we saw that there was a lack of clarity, we want to re-instruct the team after our evaluation so we can go out and do a good job.
Understood. You know, the Manhattan District Attorney, Alvin Bragg, came out with his own plan. I'm not sure if you saw it, which he says is a bit separate from yours and is more voluntary to get people to treatment. So I don't know if you saw it, but if you did, do you agree, disagree?
Oh, kudos. I'm loving where we are right now. Here it is. We took a bold step to say we're no longer going to ignore our fellow New Yorkers. And now the chorus is joining us. He's complimenting our plan, like what Norman Siegel is doing with volunteers and other New Yorkers are doing. This is an amazing moment for our city. We took a bold step, refused to punt the ball, and you're seeing other entities saying, how do we step up? And kudos to Alvin Bragg, and we're going to coordinate with him. It's a compliment to our plan.
Okay. Now, you talked about this at the top. One of the big issues that you faced as mayor was this influx of migrants coming from the southern border, right? Bussed here by local leaders in those southern states. Came as a huge financial strain to the city. So you're now looking to get that federal support. You've talked about this. Reportedly, $1 billion from the federal government. Are you confident that you're going to get that money? Have you had a conversation with the president?
It's unfair if we don't. We are communicating with the White House regularly. You know, we have to be honest about this. It's unfair to everyday New Yorkers who are already dealing with their crises. We're already dealing with the housing crisis. We're dealing with so many crises. It is unfair to New Yorkers to carry this burden on their own. This is a national problem, and the national government and the state must stand up. We've done our share, and we've done it well. We've showed the country how to be compassionate to those who are asylum seekers and migrants, but it's unfair to New Yorkers to have this price tag. And so we're looking forward to the legislation that's moving through Congress now to come up with the funding that's needed. Kudos to both Congressman Jeffries and Senator Schumer, who's advocating with the rest of the New York delegation.
You know, Mr. Mayor, I want to talk about the situation that's unfolding also at Rikers Island. It's been going on long before you took office, but in this past year, 19 inmates have died. So why does this continue to happen, and who should be held accountable when you see this number?
Well, let's really dig into the number. Many of the inmates that are on Rikers Island are dealing with severe health care issues. And, you know, we're dealing with a population that a substantial number are dealing with mental health illnesses. A number are dealing with other illnesses, diabetes, heart disease. And then you have the heavy flow of drugs. And that is why Commissioner Molina is really zeroing in on stopping drugs such as fentanyl from coming into the system. It's coming in through various means, and he's putting in place initiatives to prevent it from happening. But when you look at 19 inmates, drill into the number. If it was 19 inmates being murdered, that's a different conversation. But if you're dealing with 19 inmates that are dealing with mental health issues, dealing with physical health issues and overdoses, that's a total different conversation. We have to stop the drugs, but we cannot ignore the fact that some of our inmates that we lost were dealing with medical crises at the same time.
And briefly, because you mentioned Commissioner Molina, he actually appeared right before the City Council's Committee on Criminal Justice last week, talking about how he's unsure if the city will actually be able to close Rikers Island by the year 2027 because of the population being so high. Your thoughts on this? Is Rikers set to close?
The goal is to follow the law, but we're not going to be irresponsible. It's clear that the architects of this desire to close Rikers did not have a plan B. What do we do if the prison population is not the population that was predicted? I am not going to participate in being irresponsible. You cannot say if someone commit a crime that we have no vacancies to put you inside for committing that violent crime. And I think we need to evaluate where we are and do we have enough space on the proposed beds. Some state just don't have people going to jail. I'm sorry, I don't subscribe to that theory for violent individuals in the city. We don't need to put people in jail who commit petty crimes. They could have alternative means, but if we have violent individuals, they need to be held accountable, and we must make sure that plan can fit that.
All right, that was this past year on the issues. We still have a little more time with you, Mr. Mayor, so coming up, where he sees things in the next 3 years, looking ahead, right?